Alright, good afternoon, everybody. I'm Dr. Gabriel, and I'll be speaking on hypertension today. It's part of our series of healthcare awareness at Desol Medical Center, where we look out for the overall health of everyone, as our motto says. Today we're going to talk about hypertension, of course, also known as high blood pressure. It's a very, very common topic that most of us have knowledge about. We are all aware of hypertension. Most of us have heard of it from one person or the other, and of course, we have a lot of people that have been living with hypertension for years that we're aware of. So it's a very important topic that we want to talk about today. So I hope that you learn one or two from it. So let's continue without any further ado. So we'll quickly talk about the definition of hypertension. So quickly, what is the definition of hypertension? Hypertension is defined as a sustained elevated blood pressure in resting states, in which the systolic blood pressure is 140 and the diastolic blood pressure is 90 and above. So elevated blood pressure in which at resting states is greater than equals to 140 over 90. So it can be either of them or both. You make sure your blood pressure is well checked, you take your medications, and ensure that you live a healthy lifestyle as instructed by your healthcare practitioners. So for individuals generally, people who have lived with hypertension for some time, they generally have symptoms that make them aware that their blood pressure is really high. Generally, they are non-specific symptoms. So these non-specific symptoms, they might look like warning symptoms, but for individuals who have not checked their blood pressure before, for individuals who do not even know that their blood pressure is high, they might attribute those symptoms to other diseases. So because hypertension does not necessarily have a particular symptom that it shows. Advise that they come to clinic, get advice even if they are on medication. So to know if we're going to alter their medication, to know if we're going to add more to their medication, to know if we're going to subtract from their medication, and then all whatnot. So for these individuals, anybody that's experienced symptoms like this, we advise that they present to the clinic and have that sorted out. So one important thing is ensuring that the lifestyle modification is put in place. They now recover without any complication whatsoever. Sometimes they might find out that they have some facial distortion when they had those symptoms, and then afterwards they find out that they are okay. So they might have had a transient ischemic attack, possibly a stroke that would have happened but was not, let's say that an obstruction that happened in the brain was not sustained, and all that. So with these individuals, you have to now start managing the stroke before you now start talking about lifestyle modification and the rest. So we don't want our patients to have to get to that level where the blood pressure is elevated and they develop complications. These are the things we are trying to prevent by doing our monthly health education, our monthly series that will continue next month with other topics too. So we are ensuring that if you have a relationship with this hospital or with this clinic, you have an assurance that you have good information to live a healthy life, good information to make sure that your clinic time is less, you get to come to clinic less often, you get to have a better life, and you get to live healthy, because that is the aim of healthcare practitioners. Our aim is to ensure that our patients lead a healthy life.